If you were to see me about 7-8 years ago when I started this journey and told me I'd be working with children, treating tongue ties, etc., I would think you're crazy. It's now got to a point that I'm only mainly doing tongue tie releases, airway-based dentistry, and my implants and oral surgery in my spare time. So it's a complete U-turn for me. What kind of gives me the motivation to do what I'm doing is a child being able to speak easier, express themselves a lot easier, a baby being able to nurse and latch better, and all down to the very quick wave of a laser. If it's not an anterior tongue tie, people are like, it doesn't exist, especially that's what I learned at university. Ankyloglossia is a tie of the tongue. But on my eyes and what I've seen in my experience, there are so many different types, and it's not always black and white. Mother intuition is our oldest medical tool, and if we didn't rely on it, we wouldn't be here as a species. Most of my patients with symptoms come to me at the posterior ones or the mild ones rather than the more severe or anterior ones. We are not born to be mouth breathers. We're born to breathe through our nose. If you have a tongue tie, studies are showing that you're 3 times more likely to snore. The body will kind of push the teeth out the way to optimize breathing, and the body doesn't really care about straight teeth. The body's caring about oxygen. But I wouldn't treat the tongue tie just purely for sleep apnea unless we are part of a bigger team at that point. We're even seeing some links, myself and my speech therapist, between stuttering and a tongue tie as well. And we've helped a lot of children overcome their stutter by treating the tongue tie. You don't need an RCT to prove the efficiency of a parachute when jumping off a plane compared to a bag of clothes. I have performed tongue tie releases without myofunctional therapy and with myofunctional therapy. And the difference is tremendous when you do it with myofunctional therapy before. What I've seen in my past is when you don't do myofunctional therapy and you do a tongue tie release, you're just throwing the system off completely. We need to suture the area so that then we have primary intention healing and a thinner scar area to stretch afterwards. So if you've done a great orthodontic treatment, but you've not taken into consideration the myofunctional compensations, you're then going to be having to retreat this patient. When I treat an adult or when I treat an older child, I'm always working with an orthodontist and myofunctional therapist because that tongue needs space. And if it doesn't have space in the mouth, it's going to go full back. Treating a tongue tie only isn't going to make your life different. It's a process. Surviving and thriving are 2 different things. We're all made to survive, I agree, but thriving is completely different.